Hello, Mr. Jones. I understand that you have been suffering from hypertension for some time and that you have not yet undergone a treatment to control it. And it is in my knowledge that you're interested in learning about this disease. I will explain little by little about it. Blood pressure is a measurement of the force exerted against the arteries' walls as the heart pumps blood through your body. Hypertension is the term used to describe high blood pressure. Normal blood pressure is when the blood pressure is less than 120/80 millimeters mercury most of the time. High blood pressure or hypertension is when both of your blood pressure numbers, the systolic and the diastolic, are greater than 130/80 millimeters mercury most of the time. There are three types of hypertension. The first one is called primary or essential, and this one is when there's no underlying cause of arterial hypertension is identified. Secondary hypertension is caused by another condition or by a drug-inducing hypertension. Examples are chronic kidney disease, adrenal gland disorders such as pheochromocytoma or Cushing syndrome, or hyperparathyroidism, pregnancy or preeclampsia, or medications such as birth control pills, diet pills, some cold medications, migraine medications, corticosteroids, some antipsychotics, and certain medications used to treat cancer. Narrowing of the arteries that supply blood pressure of the kidneys, such as renal artery stenosis or obstructive sleep apnea. And the third type of hypertension is called the malignant hypertension. It is a dangerous form of very high blood pressure where the symptoms include several backache, nausea, vomiting, confusion, vision changes, and nosebleeds. Pathophysiology of hypertension. Well, is it a common disease in which the blood pressure against the walls of the arteries over time is high enough to cause health problems such as heart, eye, kidney, and blood circulation? High blood pressure is a silent disease with no symptoms for a very long time. So without early detection of its complementary treatment, it can cause serious consequences such as heart attacks, strokes, or even damage to other essential organs such as kidneys and eyes. When blood pressure is very high, the walls of the left ventricle of the heart tend to thicken and need more oxygen, which would cause a heart attack due to relative shortage of oxygen supplying the muscles. If the elevation of the blood pressure produces alterations in the blood vessels of the retina, we speak of hypertensive retinopathy. It's a hypertensive retinopathy, the arteries responsible for carrying blood to the retina or for sustained high blood pressure of the sustained basis. As a result, these arteries become thicker, making it difficult for blood to pass. They can also contract, and when they narrow, the blood flow slows or it might be even blocking, causing lack of blood supply in some areas of this retina. Also, it increases the permeability of the arteries, which facilitate the leakage of fluid and substances from these vessels that accumulate in the retina, inflaming it, that has a name called retinal edema. All these damages can cause bleeding. Blood pressure is determined by both the amount of blood your heart pumps and the degree of resistance of the blood flow in your arteries. The more blood your heart pumps and the narrower your arteries, the higher the blood pressure is. You can have high blood pressure, hypertension for years without having any symptoms. Even without symptoms, damage to your blood vessels and your heart continues and can be detected. Fortunately, high blood pressure can be easily diagnosed, and once you know you have hypertension, you can work with your doctor to control it. In your case, Mr. Jones, with symptoms of respiratory distress when active, with a history of uncontrolled high pressure, in addition to his family history that his parents died of hypertension, and adding to his stressful lifestyle due to the type of work he performs, the consumption of alcohol, the unhealthy diet, the lack of exercise, and the gaining of weight, your entire social history plus symptoms of respiratory distress when you're active show us that you may be a candidate for developing severe complications that could lead to death or disability. You must see your primary care physician for treatment and counseling regarding possible lifestyle changes, which can help control high blood pressure to reduce the risk of life-threatening complications. You must be clear that high and complicated pressure can lead to aneurysm, which is the enlargement of section of the wall of the vessel in the form of bulge that can rupture and cause life-threatening internal bleeding. It could also cause heart failure, which consists of the weakening of the heart muscle, which causes the heart to work less efficiently, so this organ may begin to fail as a pump. Here are some recommendations to improve self-care and thus avoid complications. Try to change your lifestyle and diet. Eat a heart-healthy diet, which includes potassium and fiber. Drink lots of water. Do at least 40 minutes of moderate to vigorous aerobics exercise at least 3 to 4 days a week. If you smoke, you must quit. Reduce the amount of alcohol you drink. Pay attention to the amount of sodium salt which you consume. Aim for less than 1,500 milligrams per day. Reduce stress. Try to avoid stressful factors and try medication or yoga to de-stress. Maintain a healthy body weight. Finally, I recommend that you attend your primary doctor regularly and to your cardiologist, who will work on keeping your pressure stable. Not forget the dietary and daily routine changes that you must make that will depend only on you.